Hi, everybody. We will get started in just a minute. I want to wait until noon to give everyone a chance to get onto the webinar before I get started. My name is Nicole Devereaux, and I will be your presenter today. All right, I know that it's most people's lunch hour right now, so I want to get started right on time. Welcome to our first Education Series webinar. Again, my name is Nicole Devereaux, and I am a research scientist with the New Mexico Sentencing Commission. If you have any questions throughout the session, please use the Q&A function. I will try to answer questions as we go, and if not, I'll get to everything at the end of the webinar. Today, we are talking about types of diversion programs and examples from New Mexico and around the United States. As you can see, we are focusing on three main points of contact in the justice system as places where diversion can take place. But first, let's define what we mean when we talk about diversion programs. A diversion program is just any intervention or program that redirects or diverts an individual away from formal processing in the criminal justice system. Diversion programs are usually for low-level, non-violent offenses, including but not limited to drug use and possession, alcohol-related crimes, petty theft, prostitution, etc. When an individual is diverted away from processing, they are instead provided with services, usually case management and treatment for drugs and/or alcohol. Other services that can be provided include access to trauma-informed counseling, help obtaining temporary or permanent housing, medical care, and assistance with any other support services that an individual may need. The three main points of contact that we are looking at are: one, pre-arrest or pre-booking diversion, when a law enforcement officer or an EMS provider initially comes into contact with an offender, but before an arrest is made or before charges are formally filed. Two, pre-adjudication, so after an individual has been arrested and charged, but before sentencing. Usually this is done through prosecutors and judges within the court. Many programs at this point of contact are called specialty or problem-solving courts. And last, diversion at adjudication or sentencing, which typically results in a deferred or suspended sentence or a sentence to treatment. As we move forward, if we have missed any newer operating diversion programs in your area, please let me know through the Q&A. I'm trying to go over as many examples as possible, but there are many variations of diversion programs. And with that said, let's go ahead and start by looking at pre-arrest and pre-booking diversion. So when we think about pre-arrest or pre-booking diversion, the most widespread and well-researched program is LEAD, which stands for Law Enforcement Assisted Diversion. LEAD started as a pilot program in Seattle in 2011. The initial program aimed to reduce racial disparities in the criminal justice system by responding to drug possession, drug sales, and prostitution with support services instead of prosecution and incarceration. The Seattle LEAD program has been evaluated extensively since its origination and was found to be associated with 60% lower odds of arrest and 39% lower odds of felony charges compared to business as usual, as well as evidence that we have less recidivism for offenders after they've received supportive services. Due to the success of LEAD in Seattle, LEAD has expanded to have programs all over the United States. The LEAD National Support Bureau provides resources and support for jurisdictions that are exploring or developing their own LEAD programs. Currently in New Mexico, we have operational programs in the city of Santa Fe, in Rio Arriba County and Espanola, in Albuquerque and Bernalillo County, at the Pojoaque Pueblo and in Las Cruces and Doña Ana County. Gallup, and then the town of Taos, as well as the county of Taos, Las Vegas, Lee County, Hobbs County, Lovington County, and Santa Fe County are all planning to implement LEAD programs. And the Cayo Pueblo and Alamogordo are exploring options into bringing LEAD into their jurisdictions. Again, LEAD has expanded all over the country. This map is from the LEAD National Support Bureau. The sites in blue all have operating LEAD programs. Purple sites are launching LEAD programs. The dark orange sites have LEAD in development, while the light orange or yellow sites are exploring bringing LEAD to their jurisdiction. Again, note that Las Cruces does have an operational site, so this map is not quite up to date. The other types of pretrial diversion programs, another widespread option is a district attorney pre-prosecution diversion program. In these types of diversion, district attorneys or DAs work with a defendant to achieve similar outcomes to the LEAD program. With DA diversion, the offender must be a defendant by default, as the offender has to be represented by an attorney in order for district attorneys to divert them away from incarceration. Eligibility requirements for a defendant vary and can be tailored, but usually require that an offense was nonviolent and that the defendant have no prior felony convictions. Once a defendant enters into a DA pre-prosecution diversion program, they are required to participate in and adhere to program requirements that often last anywhere between 6 and 24 months in duration. A successful completion of a diversion program is then rewarded with a case dismissal prepared by the DA. If a defendant fails to meet program requirements, they will be entered back into the traditional court system. At the end of the presentation, I have links to the different district attorney requirements around New Mexico and the different forms that they have for entry into the program. So I will make sure that you have access to all of that at the end. Currently, the New Mexico Sentencing Commission is working with the First Judicial District Attorney's Office and other University of New Mexico research partners to create and evaluate a new youth diversion program funded by the William T. Grant Foundation. The program will target individuals, both juveniles and young adults, with aims to reduce recidivism and be developmentally informed in ways that encourage young people to make successful transitions into adulthood. It also aims to reduce racial and ethnic disparities in criminal justice processing. At this point, the program is still in the development stage, but implementation and evaluation are yet to come. Moving on to our second point of contact for possible diversion, we have pre-adjudication diversion. The first type of program I want to focus on are specialty or problem-solving courts. At this point of contact, an offender has been arrested and charges have been filed. The focus of a problem-solving court, again, is to shift an individual away from incarceration and towards successful rehabilitation. Accordingly, many specialty courts focus on drug and alcohol addiction as diseases to be treated rather than offenses to be punished. Every problem-solving court has a specific type of problem it addresses, and thus a specific offense or offender type that they target. Similar to DA pre-prosecution diversion, a specialty court works with community resources and service providers to help offenders complete a court-ordered program. Typical requirements for these programs include random drug testing, drug treatment, group support, and court sanctions and incentives to help individuals get through the program. According to New Mexico courts and the judicial district websites for each judicial district, New Mexico currently has problem-solving courts for adult drug court, DWI court, family dependency court, juvenile drug court, mental health, which can also be called treatment courts, and various domestic violence courts and programs. The exact tally for those courts comes to 22 adult drug courts, 9 DWI drug courts, 3 family dependency drug courts, plus another pilot, 11 juvenile drug courts, 5 mental health or treatment courts, and 2 veterans treatment courts. So in total, there are 27 of our 33 counties and 12 of the state's 13 judicial districts with at least one drug court program. One or more of these specialty courts may have had to suspend activities due to the COVID-19 pandemic, but the rest remain operational. Bernalillo County Metropolitan Court leads the state in number and types of specialty courts, with 11 specialty courts currently functioning, including behavioral health DWI court, community veterans court, a competency court, courts to school, the domestic violence early intervention program, the domestic violence solutions treatment education program, DWI recovery court, outreach court, the pre-adjudication animal welfare court, and the urban Native American healing to wellness court. Please note that there are several other tribal specialty courts not included on the map or in this list. And while we're talking about problem-solving courts, they are proven to be cost-effective compared to incarceration or detention and reduce recidivism rates. There are also programs that combine elements of both pre-arrest and pre-adjudication diversion. One example of a combination program is Project Hope. I came to know about Project Hope, HOPE standing for Hawking Overdose Partnership Endeavor, when they presented their program at the 2020 COSAP conference. COSAP is another grant opportunity run by the Bureau of Justice Assistance Branch of the Department of Justice. The acronym for COSAP stands for Comprehensive Opioid Stimulant and Substance Abuse Programs. This particular program, Project Hope, is a mix between the pre-arrest and the pre-adjudication model. So they have, let me tell you more about where it is. So Hawking County is in southeastern Ohio, and it's a very rural area. They have only one ambulance that services the entire county out of the city center of Logan. Despite the rise in opioid use and overdoses in the area, the community was resistant to Narcan distribution and needle exchange programs. So in order to combat the opioid epidemic, the county health department, sheriff's office, county EMS, county prosecutor's office, and several service providers, it's a long list, came together to devise a team that is in part home visit and service provider and in part specialty court. A core team of program staff of public health nurses and sheriff's department officers go home to home and do home visits for high-risk community members to see if individuals are ready to engage in services or treatment. If the individual at the home agrees to services, the team immediately provides any number of assistances, including Narcan, HIV tests, referrals to other healthcare visits, and even as far as booking inpatient treatment right there while they're in the home. Other individuals are diverted into a specialty drug court called Vivitrol Court. For those of you that might not be aware, Vivitrol is a brand name for naltrexone, which is a treatment for opioid addiction. If they're referred through the Vivitrol Court, individuals then also have to participate in the home visits and resources provided by Project Hope nurses and sheriff's officers. The program has been so successful that they've expanded into other counties within southeastern Ohio. And again, this is just one example of ways that you can creatively combine various points of contact in a diversion program. Our final point of contact that we're focusing on is the diversion at adjudication or sentencing. So if an offender has not been diverted out of the formal system by the time they are adjudicated or sentenced, there are still alternatives to incarceration and programs to help offenders stay out of the system in the future. In New Mexico, these sentences and programs rely on an interaction between the court and the New Mexico Corrections Department. And all of them are already part of New Mexico statutes. In the first two categories, we have deferred and suspended sentences, as well as conditional discharges, where an offender has potential to have their case dismissed and their record expunged by successfully completing the terms of their probation. In the third category, we have sentencing to treatment or sentencing to a special incarceration alternative program. Here, the offender is subject to completing treatment and participating in other services and training before being released to their probation term. And they are also offered post-release services. As stated at the beginning of this webinar, we can touch on many types of diversion, but this presentation is by no means exhaustive of all of the variations of programs that exist out there. If you heard something so far that you think might work in your jurisdiction, but you still want more examples or information on exactly what implementation might work or how you might even go about starting it, the National Institute of Justice has a repository of programs that are already rated and evaluated on their effectiveness. So I just did a quick search for diversion programs alone in that one filter box, and that yielded 630 unique results. The website is on this slide and also included in the resources slide at the end of the presentation. And I just want to show you a couple of the programs on the list. So here are 4 examples of programs from around the country that focus on different age groups, races, and ethnicities. Each of these profiles has a lot more information available on the National Institute of Justice site, including a program summary, a program description, evaluation outcomes, and evaluation methodology, along with their cost, which is very important to everybody, the evidence base used to create the program, and additional references and related practices. So if you find something and you're like, oh, I really like that, they have other programs very similar that you can also explore. Of the 2 youth-focused programs, one is that I'm highlighting. One is the Adolescent Diversion Program out of Michigan State and Ingham County in Michigan. So they have an 18-week intervention where caseworkers that are student volunteers from Michigan State's psychology program spend 6 to 8 hours per week with juveniles in their home, school, and community. The caseworkers work one-on-one with the juveniles in order to provide them with tailored services for their specific needs. Caseworkers focus on improving juveniles' skills in several areas, including family relationships, school issues, employment, and free time activities. The other youth-oriented program that I highlighted is the Cherokee Talking Circle out of the United Kiowa Band of Cherokee Indians in Oklahoma. The Cherokee Talking Circle is a school-based manualized intervention that consists of 10 sessions to reduce alcohol and substance use in Native youth. So the students meet weekly for 45-minute sessions over 10 weeks, hosted by a counselor and a cultural expert in the format of a talking circle. Students that participate pledge to maintain confidentiality and not share anything that happens within the talking circle. And the manual is written in both English and Cherokee languages. We also have, as an example, a drug treatment alternative to prison program out of Brooklyn, New York. This program targets all drug-addicted, nonviolent, repeat felony offenders arrested in Brooklyn that face mandatory sentencing. This is different because most programs tend to not include repeat felony offenders, but this one, that is one of the requirements. You must be 18 years or older, have multiple prior, or one or more prior felony charges, and be addicted to drugs. This uses the deferred sentencing model over 15 to 24 months. Once defendants are accepted into the program, they plead guilty to a felony charge, but their prison sentence is deferred while they participate in intensive residential drug treatment, which is followed up by optional aftercare services. And lastly, I wanted to highlight a gang reduction program out of Los Angeles, California. This program was implemented for high or at-risk youth and families and provided educational, social, and behavioral interventions, which included programming in three programming types: prevention, and then intervention and reentry, and suppression. The resources were coordinated by an already existing multi-agency law enforcement collaboration called CLEAR, and that's how they got the Los Angeles Gang Reduction Program suppression component coordinated across their target area. Again, these are just 4 examples of the 630 examples of diversion from the National Institute of Justice. And you can always filter out more categories to help find something that is more tailored to your exact jurisdiction. And that is all that I have for you today. If you have any questions, please make sure that you enter them into the Q&A. And before I get to questions, one more plug for our next Education Series webinar, which will be at noon again on March 24th, titled Data Collection and Data Design with Dr. John Courtney and hosted by my colleague, Sherry Hoke. The registration link for that webinar is included here. You can also email us for a full list of our upcoming webinars and the links to each registration tab. So each one of our webinars has its own unique registration, and you need to fill out each registration to be registered for that webinar. The full slides for this presentation, as well as a recorded video, will be available on our website in the next day or so. So you can have full access to both our resources page. Hold on. There they are. So to both our resources and any of the citations I have for all of the information included in this program. And without further ado, let me get to questions. I see that there are a couple of things up here. Oh, I have new information that the 4th Judicial District Attorney's Office also uses pre-prosecution. And if you are looking to apply for the Criminal Justice Coordinating Council's crime reduction grants, you can also find information on how to apply for those grants on the New Mexico Sentencing Commission website. We definitely encourage you to think about any of these types of diversion that might work for you in your jurisdiction, and get with your criminal justice coordinating councils to start talking about what types of diversion you might be able to implement, and then apply for a grant so that you can get started. I don't have any questions at the moment, which means you all will have a much longer lunch break than originally planned. All right. Last call for questions. Give you a couple seconds to type. Well, either I did a really good job answering everything that there is to know about diversion, or you've got to go start exploring. All right, have a great day, and don't forget to register for our next webinar. Thanks.